Hi guys, my name is Dr. Mona Hardas. I am a gynecologist from Flint, Michigan. Today I'm going to talk about a little sensitive topic. Some of you may not like it, but I thought it was really important after practicing gynecology for 23 years and seeing so many teenagers in my practice. There have been some questions I always get asked, and I thought, why don't we talk about it a little bit? So, if you are a teenager watching this video, or if you are a parent watching this video, today's topic is going to be a confidentiality in a doctor-patient relationship. I do see a lot of teenagers. Some of my babies I delivered are now teenagers and coming back to see me. And the question a lot of time they have is the information what they're sharing with me, how much is confidential and how much their parents will find out. Now, if you are a teenager and you're looking for a birth control option or you're interested in STI testing, I really urge you to talk to your parents first. Take them in confidence. Tell them that you are interested in getting this testing done. I know you're worried. I know you will be worried about punishment, maybe retribution of some kind. Your parent might be upset for a little bit, but remember, they will be proud of you for taking care of your health and taking that initiative. Okay, so please talk to them first. And parents, if you are watching this video, really important to talk to your teenager. Bring this topic on. They might be hesitant themselves approaching you, but if you approach them and start talking about it, it will make it so much easier for both of you. I know by avoiding the topic and not talking about it, they're gonna keep doing what they're doing. So why not make it safer and healthier for them, right? So if you are a teenager and you are coming with your parent to see me or a guardian, that's amazing that your parent has taken the first step in bringing you to me so we can talk. Now, a lot of time the parents come in or the guardian come in, they are in the room and they stay in the room not because they want to know what's being taught, but because they want to give you some kind of a moral support. They forget that the privacy is important. In our office, we always give our patient a choice whether they want somebody in the room or not, because we do understand that you might have had some private matter to talk to me, and then we will have your parents step out. Sometimes the teenager is a little shy or she's a little, maybe not embarrassed, but worried about saying or asking mom to leave, right? So in that case, if that's kind of gonna be a problem and you do have some private information to share with me, then you can call the office ahead of time and request that we give you that one-to-one private time, and nobody would know, and we will make sure of that. So there are ways going around it without not insulting, but being embarrassed, asking to get that private time. Now, once you and me talk, when we talk about whatever sexual practices, birth control, STI testing, it is a confidential information. It's between you and me. It stays there. So most of the time, as a physician, we don't have to discuss or inform your parents about it. But there are certain things we are obliged to tell your parents. Things like, if we are worried about your health, if you're thinking about harming yourself, or there is something which is gonna cause danger to your life, we will be talking to your parents, because remember, we have taken an oath to take care of you, right? We want to help you. So that kind of an information will be shared with your parents. Now, if you say get a birth control with me, the other question I get asked, will that show on my, because I'm on my parents' insurance, will that show? Well, the EOB or we may show that you were given this medication, or their EOB, that is the explanation of benefit, may show that you had an STI testing done. So again, the best thing is to talk to them beforehand so there are no surprises. Now, if you're not in that position, or your relationship with your guardian is not that you can talk about these things, and you are worried about these things showing on the EOB, what can you do? Well, there are two avenues. One, you can pay cash and not use insurance at all, so it won't show. Again, I'm not telling you to lie, but I'm just trying to help you out to keep you healthy. The second option is to go to either the Planned Parenthood or the health department in your county, and they do have free services. They can give you samples of birth control, they can do STI testing, they have cervical cancer screening, mammogram screening. There are a lot of other services people don't know of available free of charge. You can use those services as well. The third option, I don't recommend it as much, but it's out there, is there are online services which are out there. Again, there are medical providers which will screen you. They'll ask you questions to see if you're at high risk for any kind of a hormones or medication they're gonna prescribe you, and they can prescribe you medication online and send it to you. Again, it's available, you can use it, but I would again and again recommend seeing a gynecologist, making sure that you are not at a high risk of getting any hormones, and also discussing other options which are out there for birth control, right? So good idea to see a doctor, but if you need it, these services are available. So another question I get asked very frequently is that, can I make the appointment on my own? Do I have to have a guardian or a parent's permission to make an appointment? Well, you can make an appointment, but can we see you on your own or not depends upon where you live, right? There are 27 states in United States which allow a minor to be seen on their own, but there are some states which will not allow it. Now, I practice in Michigan. In our state, there are only few circumstances where a minor can make an appointment and be seen without a parental permission. For example, if a teenager is pregnant already, it's considered adult. If they have some medical issues, then they are considered an adult. But otherwise, we have to have a parental consent to be seen. So again, bringing it to the point that important to talk to your parents and have that open communication and tell them that you are interested in learning about birth control or just getting information, and then we can talk in details about it. As a gynecologist, I'm here to help you out. I'm here to teach you, educate you about your health, the choices, the safe choices you can make. The information exchange between us is confidential, but there are limitations. It's all about your health and your safety. So if we decide to give that information to your parent, it's for your health and safety. Remember that. I want you to talk to me openly and honestly, knowing that your health is the most important one. And if you have any other questions regarding this topic, please comment below. I will be very happy to answer any of those questions.